Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, whilst providing quality care, and where we also provide tailor-made solutions for hospitals and intensive care units to save money and resources, and where we provide win-win situations for all of our stakeholders and clients. So in last week's blog, I talked about how long can a tracheostomy prolong life. You can check out last week's blog by clicking on the link below this video. In today's blog, I want to answer a question that we get quite frequently here at Intensive Care at Home. And the question this week is, can you discharge a patient home from ICU directly? Now, what a great question to look at today, because any of you that are familiar with intensive care, the paradigm in intensive care, generally speaking, for the last few decades really has been there's two options for a patient in ICU, and that is, number one, they go to a hospital ward after discharge, or they die. So that's a very limited mindset, and it doesn't serve the clients or the patients, and it doesn't serve hospitals and intensive care units either. So then the question is, can you go home directly from ICU? And the short answer to that question is yes, because with services like Intensive Care at Home, you absolutely can go home from ICU directly, especially when it comes to long-term ventilation, tracheostomy, when it comes to BiPAP or non-invasive airway management. Patients can go home directly. And how does that work in practice? Well, it works in practice, quite frankly, because we replicate intensive care in the home. So basically what we do is we send intensive care nurses into the home 24 hours a day, just like an intensive care is staffed by intensive care nurses 24 hours a day, and we do exactly the same in a home care environment. So from that perspective, we can provide an intensive care substitution service, and we can improve the quality of life for patients and their families in the home. So we basically provide all the equipment that is needed in a home care environment for long-term intensive care patients. We can provide things like home TPN, which is intravenous nutrition, but we can also provide things like enteral nutrition, like either feeds with a PEG feed tube or with a nasogastric feed tube, but overall we can also provide mechanical ventilation, of course. We can provide tracheostomy care. We can provide non-invasive ventilation care such as BiPAP, CPAP, and some of our clients we also provide seizure management at home, because as you know, when it comes to seizure management, often airways become unstable, and the only way you can safely manage an unstable airway is with critical care trained nurses in the home. So our goals in a home care environment really are our clients' goals. And what are our clients' goals? Our clients' goals are to leave intensive care. The goals are to improve their quality of life at home. In some instances, it's to improve quality of end of life in a home care environment, which is very, very difficult to be achieved in intensive care, where patients have no privacy, they have very little dignity, if any at all. Families are spending day and night in ICU to be with their loved ones, so it's a very difficult situation for anyone to stay in ICU long term. And also, by providing the intensive care at home service, we're also providing a win for the intensive care unit, because by taking long-term intensive care patients out of ICU, we're freeing up resources for intensive care units, and freeing up beds, freeing up staff, freeing up equipment, so that the next critically ill patient can actually be treated in the intensive care environment. So again, everybody is winning by providing intensive care at home for the right patients. So that is answering your question, hopefully, can a patient go home from intensive care directly? Absolutely yes, with our service Intensive Care at Home, where we provide the intensive care substitution service in a home. Now, if you have a loved one in intensive care and you want to take your loved one home on a ventilator with a tracheostomy, for example, then you should definitely contact us. Contact us on one of the numbers on the top of our website, intensivecareathome.com, or simply send me an email to patrick@intensivecareathome.com. That's Patrick, just with a K at the end. Now, and if you are an intensive care nurse and you're looking to get out of the craziness of an intensive care environment and you want to make a real difference to our clients and their families, then contact us. We have vacancies for intensive care and pediatric intensive care nurses with a minimum of 2 years intensive care nursing experience, and ideally with a postgraduate critical care certificate or equivalent. If you are highly motivated and again you want to make a real difference to our clients and their families' lives, you should definitely contact us. Have a look at our career section on our website. Now, again, if you have a loved one in intensive care and you're also looking for funding, again, contact us. We know how to go about funding for our service. We can help you with that. Also, we have been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. And last but not least, check out our service section on our website so you can see which services we can exactly provide for you and for your loved one. Thank you for watching this video and thank you for tuning into this week's blog. This is Patrick Hunzel from intensivecareathome.com, and I'll talk to you in a couple of days. Like this video, comment down below what questions that you have, and subscribe.